Uh, 3, 2, 1. We are live now. Over to you, Shweta ma'am.
Hi, good evening, everyone. Happy Women's Day, not just to women, but men, and to everyone who's actually supported them, enriched them, and for all of us as women. I'm very, very proud to be a woman, and I have an exciting panel today. But before I do that, let me introduce myself. I'm Shweta Munjal. I actually lead global communications and sustainability at Lupin. Lupin, one of the most premier pharmaceutical company headquartered in India, but true blue Indian MNC. It is an absolute pleasure for me to wish to be with you all on this amazing occasion, International Women's Day. I welcome all of our Facebook Live session audience. Warm welcome. Did I just say good evening to everyone in India? But I just forgot people on the other side. So good morning, good evening, and good afternoon to whichever part of the world you are in. Well, a lot has been said on International Women's Day, debates on gender pay, glass ceiling, etc. But one thing which hasn't been spoken much about is health, which apparently is one of the biggest issues facing women the world over. Well, women's health is actually one of the most important parameters which reflects the standard of healthcare system of a society, irrespective of wherever you operate, whichever country you're in. Today's Facebook Live session is actually on a theme which is hidden in plain sight, cardiovascular diseases, which is traditionally more related to men or male patients, both in medical literature as well as popular imaginary. We all think cardiovascular is actually a men's disease. Why don't we debunk it today? At Lupin, a leading global pharmaceutical company, we are today delving into a topic that needs attention and immediate attention. Therefore, we're dedicating this session and today's day on actually empowering women to treat their hearts right. Well, heart diseases, of course, is the leading cause of death amongst women. Are you alarmed? So was I. One that can be prevented by early diagnosis and lifestyle interventions. By the way, every year, coronary heart disease is actually the single biggest cause of death, and the number is significantly higher in women than men. Isn't it shocking? Well, why don't I actually debunk it today with an amazing panel that I have? But despite this, the risk of heart disease awareness in women, the risk of heart disease awareness in women is so low. Well, at Lupin, we firmly believe that managing cardiovascular disease is just half the part. Effectively preventing these conditions and reversing their progression forms is the other half. And that's what we're going to discuss today. Our efforts at Lupin are actually more holistic. They're all about spreading awareness about the disease, prevention strategies while offering disease management medicine and HCP support. Well, today I'm proud and privileged to have a panel of members that are here to support this initiative. Let me first start by welcoming dear Vinita Gupta, CEO of Lupin. Well, she's definitely the chief executive officer, but she's also ranked amongst 50 most powerful women in business by Fortune. And just this evening, Business World Today recognized her as the most influential woman in India in healthcare sector. Congratulations, Vinita. Well, many of you may know that Vinita has actually transformed Lupin into a global pharmaceutical industry leader. While she may have many accomplishments to her credit, I have been incredibly impressed with her strategic thought process, clarity of vision, and most importantly, her ability to create a very, very progressive and inclusive environment at Lupin. One that I, as an employee of Lupin, I'm so proud of. Thank you, Vinita, for joining us all the way from Naples, Florida. Well, my next guest on the show on the Facebook Live session is an inspiring woman, 6 times world boxing champion. I'm sure you all got it right. It is none other than MC Mary Com. Mary, yay, we are so proud of you.
Thank you so much.
Nicknamed as Magnificent Mary, she's actually been ranked #1 female light weight by International Boxing Association. She's been awarded the prestigious Padma Vibhushan, India's second highest civilian award. Salute to you in 2020. A ringside view of her life that we all watched through a Bollywood biopic. The story of her struggle, the one that truly inspired us all. A very, very warm welcome to you, dear Mary.
Well, thank you so much.
My next panelist, and I would like to heartily welcome Dr. Roxana Mehran. Dr. Roxana Mehran, Professor of Medicine and Director of Interventional Cardiovascular Research and Clinical Trials at Zena and Michael A. Wiener Cardiovascular Institute at Mount Sinai School of Medicine. She's actually joined us from New York. In recognition of her work, Dr. Mehran has been the recipient of numerous prestigious awards and special acknowledgements, including recognition as the world's most influential scientific minds. What a power panel we have. And she's consistently named amongst New York's best doctors. Welcome, Dr. Mehran. We are so glad you joined us all the way from New York.
Thank you so much. I'm really honored to be with all these amazing women on this panel, including yourself.
Oh, thank you, Dr. Mehran. I'm also very delighted to introduce Dr. JPS Sahani, a senior consultant cardiologist and chairman of cardiology at Sir Gangaram Hospital in Delhi. He's a recipient of many oration awards and gold medalist at the Rashtriya Ratan. Dr. Sahni is known for his contributions in research field in India. Warm welcome, Dr. Sahni. We are very proud to have you on board.
Thank you very much, and wish you all very happy International Women's Day.
Thank you so much. And my next panelist, distinguished panelist, is Dr. Sarita Rao, a senior consultant and interventional cardiologist from Apollo Hospital, Indore. Among donning various hats at Indore Hospital, Apollo Hospital, she's been very versatile in imparting knowledge to students, peers, and members of medical fraternity. We're very proud to have you, Dr. Sarita Rao, on board. Thank you so much for taking the time out and joining us.
Thank you, and a very warm Women's Day to everybody.
Thank you.
Thank you.
And finally, let me invite and introduce Lupin's President of India Region Formulations Business, Mr. Rajiv Sibal. Rajiv is a seasoned pharmaceutical professional who's played significant role in bringing many novel medicines to India and leading the growth of our India business. Rajiv, warm welcome. We met in the morning, but we meet you again. I'm so proud to welcome you on the panel today. Rajiv, why don't I request you to kick off the conversation by helping our Facebook Live audience understand the real thought process behind Shakti? We have it on our backdrop. Over to you, Rajiv.
Thank you, Shweta. Am I audible, Shweta?
That's right, you are.
Shweta, am I audible?
Yes,
Yes, Rajiv,
okay.
We can hear you loud and
clear. So before I say anything, Shweta, let me wish all the women a happy International Women's Day. It truly amazes all the men how effectively you manage numerous roles in a day, whether it is personal life or professional life. Coming to today's event, it is a pleasure to be a part of such a distinguished panel. My personal welcome to Vinita Gupta, who has taken out time out from her busy schedule to be part of this discussion. NC Marycom, Dr. Roxana, Dr. Sahni, and Dr. Sarita. I'm sure the perspective that you all will share today will have a significant impact on everyone who is watching this live event. Today, we all have come together to launch a very noble activity, which we have named Project Shakti. The name Shakti signifies the element of feminine energy that is responsible for bringing all of us into this world. It also rightfully means the strength that we possess. For us, Project Shakti is an attempt to promote the message of having a healthy heart by ensuring early detection of any cardiac ailment and taking care of it through a holistic approach. You all will be surprised to know, which Shweta has already spoken about, that heart diseases kill more women than all cancers combined. In fact, data suggests that the death rate of cardiovascular disease in women is 35% as opposed to 32% in men. And despite this, the risk of heart diseases in women is still under-recognized, underdiagnosed, and undertreated. So at Lupin, we decided to mobilize the women by educating them on healthy lifestyle changes and raising awareness around managing their cardiovascular conditions. We believe making women cognizant of the early indicators of heart disease can lead to a healthy tomorrow. Shakti has been created with this noble purpose, and we at Lupin believe that any step taken towards improvement in awareness of heart disease in women can lead to necessary radical changes in the perception of the society and healthcare professional towards this condition, ultimately resulting in early diagnosis and early treatment. Shakti is one of many exciting initiatives that Lupin is taking in this direction. Shakti has already promoted awareness towards heart disease in women among 42,000 individuals through various digital platforms. We are very happy to announce that Shakti has also received the prestigious India Health and Wellness Award in the Best Non-Communicable Disease Prevention Campaign category. This only encourages us to work more towards launching such awareness initiatives and making India a healthy nation. Thank all of you for joining this discussion, and I really look forward to this exciting evening of discussion with distinguished women leaders panel. So now I would like to request
We can't hear you anymore,
Vinita Gupta,
Rajiv.
our CEO, to
Yeah, we can hear you now.
Ma'am, over to you.
Okay, thank you, Rajiv. I think you cut off at the end, but I assume that you were introducing me. Thank you very much. First of all, I would like to wish all the women on this panel and our organization, and also all the men that support and empower us women, a very happy Women's Day. I am delighted to be part of this panel with Ms. Mary Com, who epitomizes strength in women, and all the thought leaders that we have online from India, from the US, that can shed light on the challenges that we face as far as cardiovascular diseases as women and how we can prevent and address them. So on the theme on Shakti, I'd like to really share my thoughts. You know, healthy heart will give you the courage to face and overcome any challenge in life. I believe that. I'm a strong believer in building strength as a woman, and it starts from our heart. I'm passionately and personally invested in Shakti, as I've also seen so many people suffer from heart diseases owing to lack of proper knowledge and timely intervention. The WHO, the World Health Organization, released a report on the most common causes of death for women worldwide recently. According to their data, women have a 1 in 3 chance of suffering from cardiovascular conditions. Can you imagine? 1 in 3, 1/3, chance of suffering from cardiovascular conditions. Despite these red flag statistics around cardiovascular disease, the danger it poses has been too often ignored. The American Heart Association's national survey also shows that women are often unaware of the signs and symptoms of heart disease and stroke. In fact, they tend to ignore symptoms as compared to men and often forget to report them. Consequently, it is crucial to increase awareness about women's heart health and educate folks about the risks and preventative measures. In addition, many women say their physicians never talk to them about coronary risk and sometimes don't even recognize the symptoms, mistaking them instead for signs of panic disorder, stress, and even hypochondria. This, unfortunately, is due to the fact that research has been lacking in cardiovascular disease symptoms in women and the differences of the symptoms between men and women. There's been more research done on cardiovascular risks and treatment for men than women, unfortunately. This is the exact gap and lack of understanding that our initiatives aims to fill. Shakti is an endeavor to break this disconnect and to change the perception of the society and healthcare professionals towards heart diseases in women. Although men and women are equal in terms of mortality rates, from almost equal, like Rajiv said, 35% in women, 32% in men, women's cardiovascular systems are different. Women experience different symptoms. In addition, women's coronary arteries are smaller and lighter than those of men, making us more vulnerable to damage during a heart attack or other heart disease. Furthermore, women are twice as likely to experience complication following a coronary angioplasty. While there are many risk factors associated with heart disease in women, prevention efforts are necessary. Some risk factors can be controlled, but others are not. Regardless of age, women should be encouraged to see medical care if they have a high level of cholesterol, for example. In addition, they should be educated about their risk factors and take steps to reduce them. This way, they'll be able to make informed decisions and avoid complications associated with heart disease. While prevention is the key, it is also important to understand risk factors, causes and symptoms of heart disease, and make lifestyle changes to prevent the condition. My message to all women who want to live a healthy life and avoid cardiovascular illness is one, avoid toxins. Lose the habit of smoking. I know it's a stress reliever in some ways, but it really builds stress in our system. 2, make healthy food choices. Lose the junk food. It doesn't do us any good. 3, make fitness and exercise part of your routine. I certainly have made it part of my routine and my family's. 4, don't let stresses get to you. When we have a lot of stresses in life, and it's easy for me to say this, but, anger, frustration, worry, disappointment, negative emotions take a toll on our heart, brain, and body. Don't let justified emotions rob your health and well-being. And lastly, get regular checkups. Don't ignore your health. We tend oftentimes to really ignore. We think everything is okay. If you'll go to the physician, you'll go get a checkup when things are not okay. Diagnostics have advanced to a level that you can get ahead of issues and prevent heart disease. Leverage it to ensure your heart health. Take care of yourself. Take care of your heart. I hope these messages resonate with you. Shweta, with that, I will hand it back over to you.
Great. Thank you so much, Vinita and Rajiv, for truly setting the context. Well, if the objective was not to scare you, actually, as Vinita said, prevention is half battle won. And we at Lupin are here to truly debunk, which is why we have an amazing panel. Why don't I actually start a fireside chat with my amazing panel here? Dr. Roxana, I'll ask you the first question. I've actually read a lot about you, your interviews, and your role in raising awareness for heart diseases on global platforms. It has been pivotal. What do you think? Why do you think, in fact, it is important to raise awareness about heart diseases, particularly cardiovascular risks that women face?
So I just want to thank you for inviting me to be part of this panel. But most importantly, when I listen to the CEO of the company Lupin speak so passionately and so informatively about heart disease in women, it really is I'm inspired by that because most often that is the part that's missing. And I think having a company that now has a program, Shakti, that will go after this in raising awareness is incredibly important. As you know, I'm the lead commissioner for the Lancet Commission on Global Burden of Cardiovascular Disease in Women. And the news are not great for women. While the number one cause of death in women is there for heart disease as the #1 cause of death around the globe. Awareness has decreased. And in fact, in certain countries, there's an increase in mortality and presentation of myocardial infarction for women. These are daunting statistics, and it's time to do something. And our commission has put out 10 top recommendations, and raising awareness and educating and going to where women are is the #1 area. And very importantly, is inclusion of women in clinical trials, and importantly, changing the way we think about how to deliver care in women. We should not be seeing women for the first time for cardiovascular evaluation in a postmenopausal state, but rather we have an opportunity to prevent cardiovascular disease and intervene as early as the time of inception. So it's never too late and never too early to educate and intervene and prevent the #1 cause of death in the world, which is heart disease for women. And I think we can do that. Reducing the global burden starts with prevention and starts with awareness, and it starts with inclusion and understanding that it's not just the typical risk factors, but rather the sex-specific risk factors that we should be thinking about, as well as the under-recognized risk factors such as stress, anxiety, partner violence, the cultural role of women in society that has undue stress for them that predisposes them to cardiovascular disease. There is no stronger reminder of how stress and anxiety can disproportionately affect women than the COVID pandemic. We saw that first and foremost. So for me, it's incredible to be here and to see that our commission has had an important global impact, and to see that you have a program that's right in line with those top 10 recommendations in private-public partnership to raise awareness and to springboard towards the future of reducing the global burden of disease is a tremendous great news. And to have this program is a wonderful, wonderful beginning on this International Day for Women. Thank you for having me.
Thank you so much, Dr. Roxana. Mary, I actually come to you. My next question is actually to you, Mary. We, as women, not just as women, as people, we actually applaud the mother and the fighter, Mary, that we saw. And we know you've scaled through the toughest hurdles to reach to the top where you are. You truly are an inspirational woman. You broke many stereotypes. You know that married women, especially mothers, cannot become successful. There have been a lot of stereotypes that mothers cannot be successful athletes. You truly, through your grit and determination, broke that myth, right? What is your message for women to take care of their health, and more specifically, heart health?
First of all, I would like to wish all the women. Today is, very special for all the women across the world. So, I wish International Women's Day, to all of you. Happy Women's Day to all of you. And I hope, your health and, we all think about our health, and, we always stay blessed and take care of our health and well-being. It's very important to all of you. And of course, I was really taking care all about of my healthy wise. Of course, we always do that. We as a mother, I'm always taking care of my healthy. I do my every time exercise. Hello.
can hear you, Mary.
Yeah, you can hear me, no?
Yes.
Yeah, it's audible now. So
Yes.
actually, I am very, very, thinking about my healthy all the time, even not only in my profession. I take very important, for my health. If I'm not well-being, of course, I could not able to pursue, I cannot able to achieve in that level. Forget about the national level and state level. Actually, to reach in international level is not easy. I was, fighting for so many years before marriage. There is a lot of challenge in my life I have faced, and that challenge is a little easier before marriage, is to convince parents, and throughout, I have to come, and such kind of, taking that step is not that much difficult for me. Somehow I convince my parents, and come out, and start my career, and I achieve, that is a little bit, easy for me. After the marriage, after the birth was, of course, it was so difficult. It was so tough. Every mother also have the same, way we have facing the difficulties, the hardship, the hard work, the pains, of course. Even though I really appreciate all the women in the panelists who had comes, across, and again come back, and you know uh, um, we I really feel proud being a woman, and we break the stereo, and we are the only the example. If we not prove ourselves, I don't think other girls also can able to follow us. So we are the men, example for all the women's, for the all the girl child, for the all the women's. From us only, the girls can able to, learn something, and come out from their family, and they can pursue their they whatever they have dream in their life. So the challenge wise, if I talk, it's for my life, is I have five 5, 6, 7 challenge in life I have faced. But I won't finish today if I'm sharing about this journey. So I just want to make it a very short. And also today, why I am here, that is, we have already seen in the biopic also, so many girls, or so many women are inspired by me through of the story, or through the biopic also. And there is book also, Unbreakable. Whoever read through the book, maybe there are so many women and so many girls are inspired. That is a big achievement, I think, so far. And just want to say that I am becoming from humble background, and such I have achieved big, and why should other girls cannot able to achieve in life? So I do support every girl child, come up and fight, fight it for you, for your family, for your country, for your for everything. If you don't fight, and I don't think I don't think that we will able to achieve. We have to fight. We have to come ahead.
Fight for our health also.
Yes, I mean that is the what I was doing is awareness is, yeah, that health healthy is very important. Healthy, even if I'm not healthy at all, how can I will achieve in sports, such, in a big competition, big tournament? So even
That is my next question for you, Mary. So I think I have that
Okay.
as the next question. And before I actually ask you that, that's fine. Before I ask you that question, why don't I go to Vinita? And Vinita, my question, and I'm sure as Dr. Roxana also said, you're so inspiring when you speak of women's health, and your commitment to women's health is so evident. At Lupin too, you have developed a fantastic women's health portfolio too. In your opinion, what is the most pressing need for cardiac care for women?
Actually, what Mary just mentioned really resonates with me. She made her health a priority for herself to face any and every challenge and to be able to succeed and win at the national level, international level, at every level. I believe the most pressing need is for women to really make their health a priority. We don't do it. We really think that our families will take care of us, someone else will take care of us, while we take care of a number of folks, the household. So I think it's important to really recognize that there's a need to take care of yourself first. We need to take ownership of our health and well-being. A disciplined approach and treating one's body as an important stakeholder is supremely important from my perspective. Only when we pay adequate attention to the fuel our body needs, it supports us in bringing our best selves, both at work and home. So, that is my short answer. I believe that if we really make our health a priority, it starts there. Everything else follows. If we don't make it a priority, all of the risk factors, the preventative measures are not going to matter.
Great. Thank you, Vinita. We have diversity in panel. We had Rajiv, and now I'm going to invite Dr. JPS Sahni. Dr. Sahni, my question to you is, and we've kind of heard it here as well, heart diseases are actually causing more death in women than cancer put together. What, according to you, is it getting enough attention in India?
Yeah, thank you, Shweta ji. Thank you very much. First of all, thanks to Lupin for giving me this opportunity to be part of this extremely distinguished panel. And I've listened to the top speaker, Vinita ji, Dr. Roxana, and then Miss Mary, and brilliant thoughts they have already given us. So my view is rightly, as Dr. Roxana has said, that women used to fear about the cancer as one of the important cause of death, which later on turned out that it was wrong. All cancers put together into 8 times is the mortality because of heart disease. And we are seeing now, as the longevity is increasing, more than 1/3 of the life of women is now in a menopausal period when risk factors accumulate and they get more cardiovascular disease. So this is true, that this is a fact. Now, coming to my journey about women and heart disease, I will just briefly discuss the way back in early 2000 when Dr. Nanette Wenger, I think I pronounced rightly, she used to hold a seminar before American College of Cardiology meeting on women and heart disease. I've attended 2 of them in consecutive 2 years. I learned a lot from there. And at that time, the Go Red project was going on for awareness of women in USA with American Heart Association. So I brought that knowledge and discussed with my colleagues, and we started CME on women and heart disease, which was never discussed as a chapter in Cardiology Society of India meetings and various state level meetings, and even in Indian Menopausal Society meetings, where we started spreading this knowledge, what I gained from the USA, making aware people, and then coming to the media, that many of my colleagues and myself, we have written articles and papers and tried to show the same thing what just Dr. Roxana said, that the cardiovascular disease is the important cause of mortality in women. They should not ignore it. Now, your question of are we paying enough attention to that at this stage? I will say the last generation, I will say those women now, they are on the 60s, 70s, they generally were not in a, they were not been given good attention at that stage, because At that time, we were not aware, and the families were all not. People were, most of the women were homemakers. Education was a problem. Awareness program was a problem. Screening was a problem. So they had a lot of risk factors and all, but their medical attention was delayed. So they all had increased cardiovascular morbidity and mortality. But I will say now, over the last few years, with the present generation of women, which are there in 30s and 40s and 50s, I am finding a sea change. As a clinician, I've seen them elderly patients, and now I'm seeing the younger one. They are more attentive. They are now looking after their health, as everyone has advocated that one should go for the health for themselves is very important. So they are now coming to our clinics with the blood report, executive check reports. They look into their sugar level, lipid levels, and also they are now more attentive about their exercise program. They're eating more healthy diet. Even cooking media in India was very poor at that time. We were overeating the oil and so many things were there. But these things have changed over a period of time. No, attention has definitely improved in our country, I say, as far as this is concerned. And at that time, we made a slogan that lipid profile is more important than pap smear. I used to tell my that you see, they used to fear always the pap smear or mammography used to be there, but they never bothered about the lipid profile. And we know one of the important and most important risk factor for cardiovascular disease is lipid. And we learned also there are certain risk factors like diabetes, like obesity, smoking. They have more deleterious effect on women compared to men. They cause more, complication and leading to more cardiovascular morbidity, mortality. But these things are gradually learn and try to teach our colleagues and our the doctors, fellow physicians, and that's how things have changed over a period of time. So, but I find in spite of that, there is a great gap. Still, the guidelines, the recommendation are there. The women in India are not following that guidelines. We are also part of that. As a physician, we are also not giving much attention to them. They are coming very late to us for the management of risk factors. And when they get heart attack, they again come late. And as Dr. Roxana said, that they come with more complication and morbidity and mortality. So that is what I feel we need to improve this area further.
Great. Thank you, Dr. Sani. Dr. Sarita, my next question is actually to you. We just, heard it from many panelists that heart disease is commonly understood as a man's disease. What do you think, and what, according to you, are the efforts that should be taken to elevate awareness around heart disease in women?
Thank you, Shweta. And first of all, a few quick things I'll say before, I get to the question that you asked me. First thing, Dr. Sani, thank you so much when you said that, women nowadays are more aware about their health and they're taking steps to, look after their health. I'm so happy to hear that from you, because that is what our organization has been working towards for the past many years, discussing women's health and making women aware all the time. And Mary, I would like to say that, when I was listening to you speak, it reminded me of something that, you're an inspiration for so many women and men altogether, and especially an inspiration to children. My daughter, when she was 8 years old, she was asked to write a poem about a sports person, and the best poem would be in the school journal. And she wrote about you. And it got published in her school journal. So you hold a very special place in my heart and in my daughter's heart. And your journey has been incredible.
It's an honor. Thank you so much.
And Dr. Mehran, so nice to see you again. Dr. Mehran had just moderated a live case, which was 2 days ago, which we transmitted from Apollo Hospital Indore in the Women in Cardiac Care Conference, which went global. And thank you so much for all your inputs. Now, coming back to your question, Shweta. So you said heart disease is predominantly conceived as a man's disease. How true and how untrue? Yes, people used to think that whenever a woman complained that I'm having certain symptoms, she would say, I'm not feeling well, or I'm having some chest pain. People would say, oh, she's having a panic attack. Oh, she's having an anxiety disorder. Or she, is just complaining because she had some emotional stress at home, or she had, a disagreement with her husband, or she couldn't handle her work pressure. This is how women have usually been treated when they are actually having a cardiac condition. So heart disease is not a man's disease. It affects men and women both. And
Mhm.
actually, post-menopause, the risk of having a heart attack in a woman actually goes up significantly. And we need to, first of all, create awareness. Now, awareness is through various methods. It's through panel discussions like this, which Lupin has very well initiated. It has to be through the print media, where you have a lot of articles about women's health, women's symptoms, and all these things. It has to be through the press. It has to be through the media. So awareness among women and among their counterparts, their male counterparts, has to increase by all of these educational methods to spread awareness. Now, when we talk about heart disease in women, the symptomatology in a woman is so different, because a woman has atypical symptoms of angina, and people don't know it. They don't complain of the crushing chest pain, which men complain of. They complain of a weakness, a lightheadedness, a feeling of something not being right. They complain of some breathing difficulty. They usually don't commonly complain of a severe crushing chest pain. So a high degree of suspicion is required when a woman is complaining. Women don't usually complain unless there is something really wrong. That, having said that, it's also very important to have preventive health checks, which Vinita was talking about. I've always seen at Apollo, we have a huge program of preventive health checks. Now, I always see the men coming in. All the corporates get all their men to come in for health checkups. Nobody gets the wives of these men who are working to come in for a health checkup. So health checkups, preventive health checkups, need to be for men and women both. And it has to start early. Somebody was mentioning, and I say that the moment you hit your 30, please come in for a preventive health checkup. You need to know certain things about yourself. You need to know what are your numbers. Every woman out there needs to know her numbers. What are the numbers she needs to know? She needs to know what is her blood pressure number, what is her sugars number, and what is her lipid profile number, what's her cholesterol number. So there are certain things which every woman needs to know, and we need to educate everybody through mass programs like these, so as to they get aware about their health and they come in early for a health checkup. And heart disease in women, it gets prevented, and if they have it, it gets treated early.
Great. Thank you. Thank you so much, Dr. Sarita. In fact, Dr. Mehran, picking up threads from, Dr. Sarita Rao, it'd be great if you actually unraveled some of the unique challenges that women actually face in their cardiovascular health.
I think one of the biggest, all of the very important impediments have already been beautifully stated. I think Vinita told us about how women need to take charge of their own health. And I think we always put ourselves last. Women are the caretakers for the families, their own families, and also their parents. And as you know, with the aging parents, that responsibility often falls to the daughter. And so if you think about when women start to think about themselves, they're usually last. And we need to change that narrative, because if they're not well, then they can't take care of the family, right? And I think they need to understand how important their well-being is. And I think once you educate them about that, then they would understand. Women need to know their numbers. Many don't understand, and hypertension is a silent killer. And many are underdiagnosed, undertreated, and underrecognized. And it's something that, for example, you need to know your blood pressure. You need to know your body mass index. And that's a very simple calculation. And women don't know that. You need to know your cholesterol, the bad, the good, and where you are with your risk factors. You need to know your hemoglobin A1C. These are numbers that women should have in the back. They should just know where they stand in terms of cardiovascular risk. And then, of course, there's sex-specific risk factors that has to do with early menarche, polycystic ovarian disease, preterm labor, and pregnancy-associated complications such as preeclampsia and diabetes. Those are all important risk factors for cardiovascular disease. And those are the patients that need to be treated first and foremost. And then, of course, really important about the stress and anxiety and how we need to take care of ourselves. And, whether it's meditation and stress-free environments and getting rid of the microaggressions and being very, very determined about caring for ourselves first and foremost. These are really, really important. But let's not forget the biggest impediment is lack of women as women cardiologists. We already know that there's a sex concordance of women who present with a myocardial infarction. If they're cared for by a woman cardiologist, they do better. And yet we are very, very much outnumbered in terms of the number of male cardiologists. So we need to educate our male cardiologists and then attract the field of cardiology to women. And I think that's a part that's never talked about, but really important. For some reason, when you talk about sex-specific differences and women and heart disease, men are not that interested in it. And it's usually a woman cardiologist that cares about those important differences. And it shouldn't be that way. This is women occupy more and are more than half of the population of the world. And so we need more female cardiologists, as well as getting our male cardiologists on board in understanding sex-specific differences, all these differences in terms of the presentation, understanding and recognizing non-obstructive disease with ischemia, myocardial infarction with non-obstructive disease, doing really good prevention of all of those important risk factors. This takes a village, and I'm so glad that Lupin is taking a very, very front stage for this. So thank you.
Thank you. Thank you, Dr. Roxana. We just heard from her, Dr. Roxana, about unique challenges. You know, we need to know our numbers, as Dr. Sarita Rao also said. Mary, I come to you, and something that you were talking, in your last, the last time also. When we speak of heart health, you have a fabulous fitness regime, right? We need to know what you do to keep your heart healthy.
Yes, what I do for my heart actually very healthy. It's very important. If my heart is not healthy, I don't think, how much I can stress myself in my field. That will be not possible. And of course, in my field, exercise and diet it's very important. And most of the time, I always, I just want to give a little, share about my experience. Also, I take all, concern, whatever I took diet or medicine or supplement from my dietitian. I took all the time to doctor, whatever I took medicine. The I always concern with the doctor. I don't take without my knowledge, my knowledge, I don't take anything else. I take only with the doctor knowledge or my dietitian knowledge. So I really take care of my health and especially my heart. So I just want to, share this experience to all the women. We have to be careful. We have to take care of our health, especially for our heart. And I want to give this experience to all of you. If we are not healthy, if we are not well-being, of course we cannot able to do whatever we want. And being a mother is very difficult. We have to we have so many responsibility. We have to do so many activities at home also. If we are not fit at all, I don't think we can able to do such kind of work. So healthy is very important to all the mother and to all the women, especially. We all know that in our country there are so many cases like heart disease and surviving. We have to fight fight wise, whatever the doctor concerns, we have to follow properly, diet wise also. Even we have to do exercise as well. So we can, have more Shakti than that. Otherwise, I don't think this is difficult to, survive. And if you do such kind of the doctor advice and, giving suggestion, we have to be very careful. We have to follow all the suggestion and all.
Mary, before I move on, I just want to know, I've heard so much about your skipping workout. Why don't you
Yes.
talk about that?
Well, skipping workout it's for me it's I think for boxing it's very important. For other maybe other normal people also, if they don't have places such, to go and do exercise at home also, we have a very small room that we can manageable. Only one skipping, and I skip is incredible. I could not able to tell you. I skip 1 hour without non-stop.
Truly are amazing.
Yeah, without non-stop, I can burn so
Amazing.
much, so much fat, so many calories. I don't know other girls can able to do or not. Even 1 hour running after this age, I'm telling you. This is reality. I'm telling you my experience. I'm sharing you 1 hour running, speed level in treadmill 10 11 speed, and I run 1 hour easily and without breathe. I'm never tired. I breathe normally. Can you imagine? That
Mary,
is
also
medical.
apart from Mary, you're running and skipping. Tell us something about your muscle training also.
Muscle training. I have my strength trainer, and of course, I have even dietitian also. I took accordingly whatever the dietitian suggests me, because I'm not such kind of such nutrition at all. So I always concern with my dietitian. So she give me all the time, this is good for you. If not suit you, she is the immediately change other option. So I do such kind of muscle also, lifting weight and squat, and for bicep, tricep, there are so exercise. If I'm doing, explain to you, I won't finish this. I won't finish today.
That calls for another session for sure.
Other normal people must be, achieve in the high level. Yeah, to achieve in the high level such medal, that is very tough. I cannot tell you how much I do that repetition, how much I do the set, that is how much I lift, the weight. It's my weight only, I lift it easily. 55 weight I lift. So squat also 55. That kind of, I'm doing the exercise to do, to progress or to do better for the upcoming competition tournament. So, but normal people must also do exercise is very important. To healthy life is very important. Such I just want to share that for my experience. Even if I'm retirement, after all, if I retirement also, I will continue to do fitness. I won't stop at all in my life.
Excellent.
That was very energizing. Rajiv, we must plan a fitness session with Mary.
Yes, definitely. Please, ma'am, Vinita, ma'am. Please, we
I would love
should do.
it.
Yeah, I am always wants to fit. I'm more
Yes.
concerned about fitness. So I don't know other women are more concerned or not concerned, but I usually doing whether my competition is there or not. I don't care. But I am, always concerned about my health. Healthy life is very important. Even I keep telling to my children also, now that they're very stressed, actually laptop, computer, games, TV all the time. How much, how many times I have to tell them, many, I cannot around all the time. I also have my own work. I have to look after all my all household, even sometimes I have to recover also. If I don't take rest, I cannot able to do evening training properly. I cannot give 100% at all. Yeah. So yeah, all the time when I have a free time to to my children, you go out and play, go everything. Physical fitness is very, very important. Why don't you go and why don't you go out and not playing such? So I am very, very much concerned on fitness. That's it, I'm telling you.
So passionate that you are, Mary. I mean, I don't think we can actually follow that, but we are truly inspired. Actually, that brings me to my next question, Dr. Sarita Roy. We cannot follow what Mary's fitness regime is, but we really want to know what are some of the lifestyle interventions that women must change to avoid heart diseases?
So when we talk about lifestyle intervention, Shweta, lifestyle intervention is similar for both men and women. And it's very easy to remember if you tell everybody that there is a simple mnemonic. You want to go to 80, the formula of 80, and for living in a healthy way, to get to 80 and be still healthy, we say formula of A, B, C, D, E. So A is your abdominal girth, right? That means obesity. Keep your obesity in check. Whatever means you do it, but keep your obesity in check. Your abdominal girth has to be less than 80 centimeters. B means your blood pressure. Get your blood pressure checked and make sure that it remains within control. So your diastolic blood pressure is very important for heart health. We say that it should be less than 80. So keep your blood pressures in check. Get your blood pressure checked. A lot of people, they just don't know what is their blood pressure. So please get it checked. And that's why we have a World Hypertension Day too. We have a World Heart Day too. Get your blood pressure checked. C, we talk about cholesterol. Now, there are lots of cholesterol when you get a lipid profile done. But there is a bad cholesterol which we target as cardiologists, and that is the LDL cholesterol. So if you look at what is your LDL cholesterol level and get it below 80. Then we could talk about D. Now, D is for two things. One is for your diet, which is so important, which even Mary has been talking about. Watch what goes inside your mouth, because every bit of it is going to count. So concentrate on your green veggies, concentrate on your fresh fruits, say no to processed foods, say no to fast food. Kids today, all they want to have is pizzas and burgers and chocolates and pasta. Please. They're extremely bad for your body. I know they taste good, but forget about it because you have to watch your body. Say no to processed foods, fresh fruits, green leafy vegetables. Take more of fiber in your diet. Take good amount of water in your diet. Being hydrated is very important. D is also for diabetes. Know what is your sugar level. A lot of people out there, they don't know they have diabetes because they never got their sugar levels checked. They never got their HbA1c checked. They just don't know that they're diabetic. And one day when they wake up in a hospital bed because they had a heart attack, we have to tell them you have diabetes. How long have you had diabetes? They said, we don't know. We never got it checked. So look at that, D. And after D comes E. Now, E is very important because everybody's been talking about exercise. So, even the American Heart Association, it recommends that you need at least 150 minutes of exercise every week. And that is like 30 minutes, 5 days in a week, or do it as you wish. You need that 150 minutes of exercise. You do it in 10-minute gaps. You do it in 30 minutes in a day. however it suits you. Fit it into your routine. Get an exercise buddy who makes you exercise. Find a form of exercise that you enjoy. It could be dancing. It could be yoga. It could be, or just playing tennis. It could be anything that you enjoy, but you have to get your daily dose of exercise, right? Now, having said that, there's a couple of other things other than A, B, C, D, E. One is say no to smoking. Now, I come from Madhya Pradesh, where, chewing tobacco is very much in thing. Now, say no to tobacco in all forms. Tobacco is bad for you. It increases the risk of a heart attack by almost double. So say no to tobacco in every single form that you know it is available. And also limit your drinks. Absolutely limit your drinks. Another important thing I would say, I'm a woman and a woman cardiologist. Now, as a woman, every woman out there faces a lot of stress. They're expected to be superwomen. They're expected to perform beautifully at work. They're expected to be super moms. They're expected to be excellent daughters to parents and to in-laws. And, they're expected to be the driver, the cook. So whoever doesn't turn up, you're expected to be that person that day. So you could be the cook, you could be the driver, you could be the whatever it is. You could be the tutor, and you're expected to do an excellent job of it. Why? Because you're a woman. That's your job. You don't say no. All women out there, learn two things. One, learn to say no. I can't do it. It's not my job. There's no shame to it. We'll find people to do it. We'll handle the matter, but I can't do it because there's only a certain amount that I can do. Second thing, find your me time. There is no need to feel guilty about resting. There is no need to feel guilty about relaxing when your house is in a mess or when your children need your attention. It's okay to devote time to yourself and to your body because you are important. And if you are not healthy, your house is going to break down. Your children are not going to be looked after if you're not healthy. Your husband is not going to be looked after if you are not healthy. And your work is going to suffer if you're not healthy. So take time for yourself. Learn to say no. There's only so much you can do. Relegate responsibility. You don't have to do everything yourself. So that's what I would say about lifestyle interventions.
Shweta, you're on mute.
Sorry. Thank you so much, Dr. Sarita Rao. We're almost 7 minutes ahead of time, but I'll just quickly do two last questions, one to Vinita and last to Dr. Sani. Vinita, you actually said take charge of your health. Why don't you inspire all of us in telling what is the best way that you take care of your health and your family's health?
For me, it starts at home. We have to really role model it ourselves for our families. And to be honest, I'm very fortunate. DBG, my father, Lupin's founder, was a role model for all of us. He deeply cared about health, personal health, and his family's health. And so all of us learned. And if you look at all of my siblings, all of them believe in a very healthy lifestyle. And likewise, we're very fortunate. Our spouses and children have also learned that. And we can make a lot of excuses, right? I mean, you want to be able to eat well. You want to be able to enjoy yourself. However, when we are answerable to the purpose and passion for the customers we serve, it is only natural that we apply the same principles to ourselves. So I personally encourage everyone at home to exercise regularly, maintain a very clean eating regime, get regular health checkups, and make time to de-stress in whatever works for you, whether it's exercise, yoga, meditation, or gardening and cooking, which can also be very relaxing. But myself, I really enjoy fitness. So I'm looking forward to that fitness session with Mary. I try to make time to work out at least 5 days a week, not 6. I was on vacation the past 5 days. I worked out every day. Was very pleased of it. That was the only way I could afford a meal and wine. at dinner. So I was trying to make up for the toxins that I was consuming. But exercise is a very big part of it. And as Mary mentioned, it's both a combination of cardiovascular exercise, as well as aerobic exercise, that is, as well as strength training. We women need to build a strength. It's very easy for us to lose muscle tone. So it's important to do both strength training as well as cardiovascular training, aerobic training. Second, eating. We are very fortunate. Everything today has labels that tell you the calories, the fat calories, the cholesterol calories, the fiber and protein, and so on and so forth. So it's possible for us to make informed choices. And I make it very, I make it important for both myself and my family to really look at the label and see what we are consuming. Don't use your body as a place to put junk in. You have to really fuel your body to be able to help yourself be the best. So it's important to make sure that you're eating the right things. And third, from a stress busting standpoint, which there's no dearth of in our industry, and for women in general. But I really enjoy gardening, especially now in Florida, which is exactly like Mumbai for me, weather-wise, and from a climate standpoint as well as landscape standpoint. I love growing plants. I love growing orchids, and they're so beautiful. They also help you calm down. Every morning you wake up and see a new orchid bloom, and it makes you happy. So it's a combination of multiple things, but healthy eating and fitness is a very big part of it.
Thank you so
singing
much.
Also, Vinita, you forgot singing.
Singing as well, but I get that opportunity only when Rajiv, you plan it. So we need to do more of it.
Dr. Sani, my actually last question for this evening. It's normally said cholesterol causes heart diseases. How frequently should we get tested?
You see, you're right, Sweta, that the cholesterol is the most important risk factor. To make it simplified, it is the bad cholesterol, what we say LDL, which enters into the wall of the arteries. Who pushes? The risk factors like blood pressure, diabetes, smoking, stress, everything pushes LDL into the wall of the artery and causes blockages, leading to heart attacks or stroke or peripheral vascular disease. So no doubt. And then it should be tested frequently, as Dr. Sarita said, that any first medical attention any women takes, at that time one should go for the routine test, which should include lipid profile. And these days we also advocate non-fasting lipid profile is good enough to make it easier. And we should know the number of the LDL particle, bad cholesterol particle. For normal healthy women, we say around 100. For a woman with diabetes, we say around 70. Diabetes, women with cardiovascular disease, we want to keep it around 55 or less than 55. So that should be done and frequently tested it depends upon the type of patient. With healthy women, probably we'll ask every 5 years. Patients suffering from cardiovascular disease and they are on statin, they are on drugs, to look into that, whether their levels have been achieved or not. We may ask for 6 months or 1 year interval lipid profile. And most important thing is that if you need drug to control cholesterol, which is important, they should take statin, the drugs most commonly used. There's no difference in the outcome trials, although less women are represented, but no outcome difference. The drugs are effective both in men and women. So I think that's what the frequency of this can be done. I will just going to add one thing for Indian women. This just extending Dr. Sarita she's very nicely, passionately spoke about the lifestyle modification. I think in India, women will be studied. Those who are working women, I will say, they are duly employed, as she's rightly said, that they have to be super mom at home and at the same time super professional at the office. So it becomes a really stressful situation to them. And for that stress, and when we know stress, psychosocial stress is a very important risk factor for women, much more than for men. And to reduce that, we men have a very important role to play. I think in India, we still, the spouses are not very cooperative at kitchen level or whatever level you say at home. Sometimes we found that we did study in some small studies and found this is happening. I think we, as a men, we have to work. And someone is very lightly said that it is a mental stress, or it is a menu card on dining table, or is a menopausal related complication what women suffers. All everywhere, MEN is the first word. Men are integral part of that, and we should take part of and try to help the family okay. So what I say, I salute all the women in the end. They say that there any relation, they are like a wife, they are like a mother or like a daughter. Their sacrifice, their love, affection for everybody in the family is significant, which men we have to learn. But please do not forget to celebrate International Men's Day on 19th of November. so, we are learning. We will definitely be more helpful to our women folk, and always salute to, as today I listened to all the top women, including Dr. Roxana, Vinita ji, and then Mary, and you. All of you have shown us, Dr. Sarita, so well, so good thoughts you have given us. Great learning for all of us, I must say. Thank you very much, Lupin, for organizing such a wonderful symposium, such a special day for women health.
Dr. Sani, I must tell you, at Lupin, we're so inclusive. We also celebrate International Men's Day. And I promise you, at International Men's Day, we will have you as a guest of honor. On that note, why don't we've got such exciting, such a balanced panel, but let me invite Rohit on the dais. And Rohit, why don't I request you to actually close the session today?
Thanks, Shweta. With this magnificent message, I would like to thank all our esteemed panelists for sharing their valuable thoughts and wonderful audience for being a part of this session. I'm sure this session gives women, their families, and their caretakers Shakti to knock out heart disease and emerge as a winner. Shakti, which stands committed to empower women in their fight against heart disease by promoting the importance of early diagnosis, timely treatment, and lifestyle intervention. Thank you and good night to all of you.
Thank you. Thank you so much.
Thank you. Good night.
Thanks all the
Good night, everyone.
members, esteemed panel members, and thank you,
Looking
Vinita, once
forward
again.
to see you, ma'am. Thank
you,
you.
ma'am.
Thank you.
Thank you all. Bye-bye.
Bye-bye.
Bye.
Thank you so much.